Hello, I'm Dr. Mark Dailey, founder and director of the Wellness Center. If you're watching this video, you most likely have carpal tunnel syndrome. I have successfully treated over 4,000 musculoskeletal cases over the last 15 years, and many of those were revolved around carpal tunnel syndrome. I'm going to do two things on this short video. First is to explain what carpal tunnel syndrome is. Second is to offer you a gift certificate for a complete evaluation and exam. To get this gift certificate, just fill out the form to the right with your email address and first name, and you'll be directed to a website with a printable gift certificate worth $150. Now, let's talk about carpal tunnel syndrome. Carpus is a word derived from the Greek word karpos, which means wrist. The wrist is surrounded by a band of fibrous tissue that normally functions as a support for the joint. The tight space between this fibrous band and the wrist bones is called the carpal tunnel. The median nerve passes through the carpal tunnel to receive sensation to the thumb, index finger, and the middle finger of the hand. Any condition that causes swelling or a change in position of the tissue within the carpal tunnel can squeeze or irritate the median nerve. Irritation of the median nerve in this manner causes tingling and numbness in the thumb, index finger, and middle finger. Not necessarily all of them. It's a condition known as carpal tunnel syndrome. For most patients, the cause of their carpal tunnel syndrome is unknown. And any condition that exerts pressure on the median nerve at the wrist can cause carpal tunnel syndrome. Common conditions that can lead to carpal tunnel syndrome include obesity, pregnancy, hypothyroidism, arthritis, diabetes, and trauma. Tendon inflammation resulting from repetitious work, such as uninterrupted typing, can also cause carpal tunnel syndrome. The carpal tunnel syndrome from repetitive maneuvers has been referred to as one of the repetitive stress injuries. People with carpal tunnel syndrome initially feel numbness and tingling of the hand in the distribution of the median nerve, which we discussed, thumb, index, and middle fingers, and sometimes part of the fourth finger. These sensations are often more pronounced at night and can awaken people from sleep. The reason symptoms are worse at night may be related to the flexed wrist sleeping position and or fluid accumulation around the wrist and hand while lying flat. Carpal tunnel syndrome may be a temporary condition that completely resolves, or it can persist and progress, literally get worse. As the disease progresses, patients can develop a burning sensation and or cramping and weakness of the hand. Decreased grip strength can lead to frequent dropping of objects from the hand. Occasionally, sharp shooting pains can be felt in the forearm. Carpal tunnel or chronic carpal tunnel syndrome can also lead to wasting, which is atrophy of the hand muscle. That means it's going to shrink in size compared to the other hand, particularly those near the base of the thumb and in the palm of the hand. As a chiropractic physician, we can diagnose the cause of the condition and treat it with the appropriate clinical treatments. Please fill out the form to the right. Get your gift certificate as well as a few tips on beating carpal tunnel syndrome. Thanks so much for watching, and I wish you the very best of health.